Welcome to day 3 of the summit. This is the book club portion of the summit. So I want to start by asking, who's read Kim Stanley Robinson's novel, Ministry for the Future? Okay, now keep your hand up if you read all of it. It's a big book. So in that novel, Ministry for the Future, Kim Stanley Robinson imagines an apocalyptic weather event that propels the world to a global climate awakening. The implicit message is that it will take human devastation on a massive scale to spur the kind of action that we need to see on climate change. Now, Robinson imagined a sustained heat wave, not unlike the heat wave that India is experiencing now. In the book, it kills 21 million people in Uttar Pradesh, India. But for readers of that novel, those of you out there who raised your hands, a chilling question lingers. When will such an event happen to us? I would argue that it already has. This month marks the 2nd anniversary of the apocalyptic flooding in Pakistan that submerged 1/3 of the landmass and impacted 33 million people back in 2022. And the aftermath of that flooding was a public health nightmare. We saw a 5-fold increase in malaria cases, as we just heard from David Walton of PMI. We saw about twice as big a jump in dengue fever in Pakistan. And frankly, the levels of mosquito-borne disease have still not come down to the baseline from that pre-flooding era. Flood-contaminated water led to a cholera outbreak that afflicted 99,000 people in a single day in one of the hardest hit districts. And routine illnesses suddenly became life-threatening as people were cut off from healthcare and stranded on inland islands. Looking back, I think Pakistan will be remembered as the moment that the world woke up to the climate-driven health crisis. And Robinson was right. It wasn't pictures of polar bears clinging to shrinking ice drifts that motivated the world to action. Rather, it was pictures of families floating their children in makeshift rafts that spurs us to act. Now, if there were a poster child for climate's impact on health, it's arguably dengue fever or breakbone fever. As you heard from Marina Romanello on Tuesday, a warming world is a virtual playground for the Aedes aegypti mosquito that transmits dengue and other arboviruses, with the vector moving to new latitudes and new altitudes. The explosive growth in dengue over the past 2 decades recently led the WHO to declare dengue a grade 3 emergency. We've seen a 10-fold increase in reported dengue cases worldwide in the last 20 years, and we know that reported cases are actually only a fraction of the true burden of dengue. 2019 marked an unprecedented high watermark for dengue, with reported cases spreading across 129 countries. That is until 2023 and 2024, where those numbers were surpassed in many regions of the world, as we'll hear about from our panel. A study published in The Lancet Planetary Health in 2021 projected that as many as 4.7 billion people, additional people, could be exposed to malaria and dengue risk by 2070. But despite these challenges, we're actually entering a time of real opportunity in the fight against dengue. There are finally transformative new tools that are coming online, ranging from novel vaccines and therapies, investments in early warning and data systems, to novel mosquito technologies like Wolbachia, which was mentioned yesterday. With this surge in outbreaks comes new awareness and political will and growing recognition around this issue. And as we discussed yesterday, major funding institutions are mobilizing unprecedented resources to help countries adapt to their climate-driven health needs. And when you look at the nationally determined contributions from countries, mosquito-borne disease is actually the most commonly cited climate-driven health risk that countries face. We have a phenomenal and distinguished panel today to deep dive into this discussion of dengue. It'll serve as kind of a case study for both the challenges and the opportunities surrounding climate health. Now, my challenge will be to fit all of the comments and insights from this panel into an hour. You may notice a pattern. I only seem to be tapped for panels where we have 6 or more panelists. And as you can see on the screen, we have a really robust group today. I'm sometimes mistaken for a doctor on panels and introduced as Dr. Edlund. I'm not a doctor. But make no mistake, we have a truly distinguished and credentialed group of global experts from all over the world. I was reflecting that in Scrabble, you only get 7 letters. Many of the panelists today have way more than 7 letters after their name. So you're all cheating at Scrabble. So we have 2 guests in the room, and I invite you to come up and take your seats as I introduce you, and then we have 4 panelists joining us virtually. First, please welcome Dr. William Pan, who's the Professor of Global Environmental Health and Population Studies at Duke University, where he joined the faculty in 2011. Welcome, Bill. And then a repeat panelist, Aravindan Srinivasan, who's head of the Climate Action Platform at the Asian Venture Philanthropy Network, AVPN. Welcome. Joining us virtually, and I see that you're all on the screen. Thanks for being here. We have Dr. P.K. Sen, who's a public health official with 4 decades of experience holding progressively senior positions in the Ministry of Health and Family Welfare of India. That's included Principal Advisor to the Ministry, Additional Director General, and Director of the National Vector-Borne Disease Control Program, the NVBDCP. I'm just showing off that I can say that quickly. We're also welcomed by Dr. Sylvain Aldighieri, who's the Director of Communicable Disease Prevention, Control, and Elimination at the Pan American Health Organization, PAHO. We're joined by Dr. Raman Velayudhan of the World Health Organization. He's the unit head and the global focal point for dengue prevention and control for integrated vector management, and he coordinates the response to other vector-borne arboviral diseases at the WHO. And finally, we have Dr. Eong Yang, who's a professor in the program in emerging infectious disease at Duke-NUS, collaboration between Duke and the National University of Singapore, the medical school. Dr. Young has conducted research on various aspects of dengue, from disease mechanisms to epidemiology, for the past 25 years. So please join me in welcoming our full slate of panelists. So we've got a lot of ground to cover today and a lot of great perspectives to integrate. We're going to start with a hopefully quick scene setting. And what I want to do is draw each of you in on a single question. We'll start by talking about what we're seeing at a country and regional level. We'll look at how this adds up to the global picture, including how climate change is changing the global burden, and kind of what we know and don't yet know about the scale of that burden. We'll talk about opportunities to integrate dengue as a lead example of a climate and health issue area and set of new interventions. We'll look at the status of new tools as they're becoming available. And then we'll talk about what are the barriers, including but not limited to financing, to enable countries to take advantage of those tools and scale them up. So, to kick us off, let's start with some of the country-specific examples. Let's kind of get close to the front lines and what's actually happening on the ground. So Dr. P.K. Sen, I'm hoping you can kick us off by talking about the state of the dengue burden, the challenges that you've seen in India and surrounding countries.
Thank you, Mr. Martin. Can you hear me?
We can, loud and clear.
Thank you, Mr. Martin. Distinguished speakers, dignitaries, and ladies and gentlemen. It is my pleasure to join you this spotlight on climate-sensitive diseases on the backdrop of Forecasting Healthy Futures Global Summit this morning. Yesterday, Pablo Uribe from World Bank was referring to 5 pillars regarding financing on climate and health. And the most important one, the first pillar he mentioned, is understanding, deep understanding on climate and health. And this explicitly points towards the primary thing when we are talking about climate and health is, I must say, disease burden. Basically, understanding the varied spectrum of dengue disease burden, particularly in the context of climate change, is critical in defining priorities for addressing strategies which has got implications on global health security. Equally important, I think, is to address the influence of climate change on burden of dengue for advocacy to optimize financial priority in integrating dengue control into indices, particularly in the context of low and middle income countries, aligning with the Paris Agreement for accomplishing rights of health and well-being of every citizen of this world. There might be a number of sources for gathering disease burden data, and primarily it may be from the program surveillance data, or from research data, or from many other sources, from NGOs, from other isolated workers who are doing on the subject. In the context of India, country specific, if I go to India, then if we look into the program data from National Vector-Borne Disease Control Program, we find that there has been a rising trend of dengue burden in the country during the last few decades, with geographic expansion to newer areas, larger and more frequent outbreaks occurring in different parts of the country, and spread of dengue from urban to peri-urban to rural areas. And in addition, there is increased number of severe cases of dengue, and as well deaths and progression to hyperendemicity in the country. About 200,000 cases are being reported annually during the last few years. CFR is maintained at less than 0.3, 0.2%. And dengue surveillance, as I mentioned, is conducted by National Vector-Borne Disease Control Program through a well-coordinated laboratory network of nearly 800 sentinel site hospitals, supported by 15 apex referral laboratories, where cases are confirmed by ELISA methods of diagnosis. Here I must say that, as I mentioned, that there are 800 sentinel site hospitals and cases are confirmed by ELISA methods of diagnosis. I must say that these centers are mainly situated at the district and at the most sub-district level.
Dr. Sen, let me interject here. We're going to turn to kind of the health system and how we're responding. I want to draw each of you in as quickly as we can at the outset. So let me turn to you, Dr. Aldighieri. Let's hear about the situation in your home region of Pajo. Of course, we're all witnessing the flooding in Rio Grande do Sul in Brazil, and we know that dengue has been kind of fierce and frequent in outbreaks in the region. So would love a situational analysis from you.
Yes, good morning, colleagues, and thank you, Mr. Chair. In the region of the Americas, we have more than 500 million people at risk to be infected by dengue or any of the other Aedes aegypti transmitted arbovirus. It ranges from southern United States to northern Argentina, and it's evolving rapidly. It's important also to mention that the eradication of Aedes aegypti, which was a regional goal during the 1950s and the 1960s, failed during the 1970s. And now the situation is that more geographical areas are colonized by Aedes aegypti than before the regional eradication campaign. It's also important to note that the introduction in the Americas of chikungunya in 2013 and of Zika sometimes during or before 2015 has revealed that large waves of arbovirus transmitted by Aedes aegypti can destabilize the life and the societies in Latin America and the Caribbean. So regarding dengue, the year 2024 is quite complex. As of mid-June, the Americas registered over 9.3 million dengue cases, including more than 4,500 deaths. This is 3 times the number of cases reported during the same period in 2023, and it's a cause of concern for the region. And you just mentioned some countries that were affected, mostly in the southern cone. In the Americas, dengue generally follows a seasonal pattern, and most of the transmission in the southern hemisphere occurs in the first half of the year, which explains why these subregions account for most of the cases. We are talking about Brazil, Argentina, Paraguay, and some areas of Bolivia. But now this is the transition, and the season is starting in Central America. An important aspect is that 17 countries and territories in the Americas are now this year reporting the circulation of more than one serotype. So it adds a layer of complexity to the situation. And also important to mention that in the Americas, countries are really focusing on the control of the mortality by dengue. In 2023, despite the record increase in cases, the case fatality rate remained below 0.05%. This is encouraging given the spikes in cases we have seen since then. And now, a last comment. In the Americas, I would say that the game changer in terms of surveillance has been the establishment of a regional laboratory network, starting with dengue. And it was established during the late 2000s. And it had integrated step-by-step chikungunya, Zika, yellow fever, and now expanding to other arboviral diseases that are not known to be transmitted by Aedes aegypti, as Oropuche virus and the Mayaro virus. So this is the situation when we are in the Americas. It's quite concerning, and we would say that the second part of the year will be very complex also in the Americas. Thank you, Mr. Chair.
Thank you, Dr. Aldighieri. Really, really helpful, really troubling statistics. Now let's pop up to the global level. Let's talk about how this is adding up to global level trends. And let's talk about what we know and what we don't know. One of the kind of key issues in dengue is the confidence interval around the true number of cases, given the limited kind of availability of frontline testing on dengue. Dr. Eong, where are we globally in the dengue fight?
Thanks very much, Martin. Good to see you again, and my apologies for not being able to join you in person. I think globally, we're seeing the anticipated expansion of the geographic footprint of both dengue as well as the Aedes mosquitoes. I mean, you're hearing news of outbreaks happening in Mediterranean Europe that hasn't happened for hundreds of years. And I think partly it's fortunate that the mosquito that's driving this is Aedes albopictus, not Aedes aegypti. Mm-hmm. But the bad news, of course, is that if Aedes albopictus can take hold in Mediterranean Europe and expand further northwards, there's no reason why Aedes aegypti would not be able to do that. And if Aedes aegypti were to do it, then I think we're going to have a much bigger problem. I think we're also seeing this in many other parts of the world, including Africa. I think there the problem could have been that the disease rates were underestimated for a while. But I think more and more studies now are showing the true prevalence perhaps of dengue. And Southeast Asia, South Asia and Southeast Asia again have got major outbreaks happening again and again, and perhaps more frequently. So I think all sign points towards a worsening dengue problem globally, and not just confined to any one part of the world.
Thank you, Dr. Eong. And obviously the climate is contributing to that challenge, the spread of Aedes aegypti, Aedes albopictus. Hopefully you're all picking up the Latin names as we go of the different mosquito types. Bill, as you and I have talked about this, it's not just kind of the changing vector, but there are other climate-driven factors affecting dengue spread globally. So what are you seeing?
So first, I would probably say that the title of this session should be Climate and Land Cover Sensitive Disease. Mostly because when we're talking about the expansion of Aedes, that doesn't happen just because of climate change. It happens because we are changing the landscapes. We're making habitat available to different mosquito species, not just Aedes. So what we're seeing, and Dr. Aldighieri touched on this, we're seeing a movement of Aedes outside of urban areas where it's traditionally lived, and we're seeing the introduction of anophelines coming closer and closer to urban areas. So this is a great 1-2 punch that vector-borne diseases are giving us. And urban areas are growing. We're expanding that spot. Birth rates are not increasing, but migration is increasing into urban areas. Not international migration, that's a big contributing factor, but it was mentioned in the spotlight, people are moving from rural areas into urban areas to have better economic opportunities, better lifestyles, better access to infrastructure, and the places they're occupying are places where mosquitoes are proliferating. And that puts them at really great risk for several different diseases.
Thanks, Bill. So so we've heard three factors. There's kind of the changing climate. There's obviously the mosquito vector in new latitudes and altitudes, but there are also human pressures, land management, and human mobility that's contributing to this challenge. And a lot of those pressures are either driven by or exacerbated by climate change. Aravindan, you're engaging with the private sector in Asia Pacific. What do you think is going to be required to position this growing dengue challenge as a critical example, a lead example even, of climate and health response?
So firstly, I wanted to start by showing solidarity that I don't have any more letters beyond my really long name. And it's always a surprise to me, why do funders and investors listen to us? There are so many experts. And it's a bit like this clock, right? It's like a doomsday clock. I have like 5 minutes to get their attention, tell the story, and then get them to say, okay, I'll have another conversation with you. So sometimes it boils down to, the science is fine, but can we please start influencing people to how it affects them? And I think we covered this yesterday. You started with Kim Stanley Robinson, right? The storytelling part of it is very, very important. And I think having the narrative that says very simply, like you're saying 3 points, urbanization, it's going to increase. We're going to probably have another 1 billion people by 2030. Second big factor for funders is to see which way the wind is blowing with respect to their governments. And if you look at Asia, India just went through elections. Before that, it was Indonesia. Before that, it was Bangladesh. And Pakistan is also going to elections. There are a couple of other countries in Northeast Asia as well going into elections. These governments are going to set the pace for the next 5 years. Is dengue on their priority at all? Mm-hmm. So if we want to really make a dent, and this is what we have been trying to do, is to get the funders into the room where experts, but also other stakeholders can come in and listen and say, is this going to be a priority for us or not? And if it is, you are going to be fighting with multiple other priorities that are also asking for attention. So if we are able to show a pathway for social investors that aligns with a health systems approach, which is longer term, can tackle multiple things, improves the ability to respond in different situations, that's a much more sustainable manner. So this is what we're trying to do. In fact, one of the storytelling things that we did was get Dr. Eong on a video with BBC. And that's the sort of stuff that we need to keep putting in front of people and then saying, this is why it's important.
Absolutely, absolutely. And Dr. Raman, you've played a key role in elevating the sense of urgency around dengue in your capacity at the WHO. We know that it's just been elevated in its status as a public health emergency. But it's not just a growing problem. We're also on the verge of some really transformative solutions in the dengue fight. So I wonder if you could update us on kind of where we are in terms of innovations, where we are in terms of WHO evaluation of those that would act as a critical step to encourage countries to introduce them locally. And I think you're on mute, Dr. Raman.
Thank you very much, Martin. And thank you for giving me this opportunity. So we are in a very interesting phase for dengue in a range of areas. First of all, in terms of diagnostics, we are getting multiplexes into the market right now, and WHO has called for a rapid assessment for these tools so that countries can avail them, and we have already made a call, and applications are currently ongoing for that. In terms of clinical management, basically there are 2 drugs currently under phase 2 evaluation. We hope these will be made available too in the coming years. There is again a couple of vaccine candidates in the pipeline. In terms of vector control, we have 3 new tools, basically the Wolbachia, the spatial repellents, and sterile insect technique. All these 3 tools are under various stages of evaluation. The Wolbachia is the front runner, which has more or less submitted its application and is currently undergoing more thorough pre-qualification review before any recommendations can be released. And we hope we can do that within few months. The sterile insect technique is also making progress with the leadership of International Atomic Energy Agency in a few countries, and we hope some of the data would be made available for assessment. The spatial repellent has done 1 study in Peru, and they are about to start their 2nd study in Sri Lanka, which would be a great added value. They are also evaluating it for malaria at the same time. So, and one more interesting thing is Dr. Aldighieri, Sylvain had mentioned about the elimination of Aedes in the 60s and 70s, and that was basically targeted spraying. And we have a study on targeted spraying which has been done with the proper randomization in Mexico, and we expect the results to be made available during the ASTMH, and we hope that those results are positive. So that is also the 4th tool in the whole spectrum. Adding to all this, the last I would like to mention is the real need for vector surveillance. And vector surveillance is a need of the hour because we really do not know what is in our backyard. And vectors are moving rapidly. As you know very well, there was an outbreak of Japanese encephalitis in Australia, which was a complete surprise. There, Urupuchu has sprung up there was a case in Cuba recently. So these are big changes happening, and we really need to have a proper surveillance system in place. And this is something which calls for more action. I'll stop there. Thank you.
Thank you, Dr. Raman. I mean, just pause for a minute to think about what a sea change that is in the dengue fight. You know, to date, certainly dating back to the 50s and 60s and 70s, we essentially had insecticides and larvicides. You know, we could try to address the vector up front. There are still no therapies that are available, no vaccines that are available, but these things are on the cusp of being approved and being available to countries. But it's not automatic that once those tools are kind of proven and approved, that they'll be made readily available. There are a series of kind of bottlenecks and challenges that countries may face. And so let's talk about those as a group. I'm going to be a little less prescriptive now and invite you guys to jump in and weigh in. What do you see? So let's do a quick round robin. What do you see as the biggest rate limiting factor, the biggest challenge for countries being able to access and scale new tools? Dr. P.K. Sen, let's go back to you. You're also on mute. Oh, still on mute. There you go.
Regarding a new tool, Wolbachia, as Dr. Raman was referring to, actually we started this Vector Control Research Center, Puducherry. They started, they have brought from Monash University, Australia, and they reared the Indian strain, Puducherry strain rather in India, and piloting is to be done. And what I think the most important thing, as I was referring to dengue burden and actually dengue surveillance, so we need to have some tool, as Dr. Raman was mentioning, that on the point of so that we can do it at point of care. So this is very important. Field level diagnostic kits. This is important. at the same time, what is more important is we must have a dengue monitoring system, rather real-time monitoring system. We need for dengue surveillance. And this is being done in India as we had earlier through National Vector-Borne Disease Control Program. But now, right now, we are introducing Integrated Health Information Platform, IHIP, through IDSP, so that we can have real-time monitoring of the dengue situation in the country. We can have data from private sectors as well, because lots of laboratories, these data are not reflected in the national program data. So these are important. And at the same time, what is important is, apart from this number of cases, dengue serosurveillance is also important. And there should be a regular serosurveillance information, maybe from research point of view. It should be there, as we had very limited data regarding serosurveillance in the country. And one I remembered was done by ICMR from Dr. Moderator, and he had a nationwide study. And there is variation in say serosurveillance in different regions of the country. And southern part of the country was most highly seropositive, was found around 50%. There are studies, Dr. Raman was also involved in the study, I think, in Kerala. This was a small study, it was done amongst children, and it was found that only less than 30% of the children, they were found seropositive. So seropositivity is also an important consideration for disease burden estimation, I think. Over to Dr. Martin.
Yeah, thank you, Dr. Sen. So it's not just financing. There's a lot of kind of elements of the data story, from having available testing at point of care, to data systems, to serosurveillance. Dr. Aldighieri, what do you see as the biggest bottlenecks to new tools being made available to countries?
In the Americas, we have invested a lot in molecular testing, starting with the chikungunya introduction in 2013. And step by step, including during pandemics, the genomic surveillance has been now something that we are pushing a lot. In a context of collaborative surveillance, this allows countries to share information regarding detection of genotypes, the impact that they may have on the dynamics and on the severity of the diseases. This is really something that we are pushing, following all the investment made in terms of genomic surveillance during the pandemic COVID-19. So this would be the point that I'd like to highlight. Over.
Yeah, and we keep hearing again and again, we're not just talking about one vector-borne disease. We're talking about tests that can find kind of multiple diseases, as we're seeing multiple arboviruses and sometimes malaria in those same settings. Dr. Eong, would love to hear your perspective on what's going to hold countries back from accessing new tools.
Yeah, that's a very good question, Martin. If I may take a step back, I think it's not so much perhaps the access, but rather the desire for a single solution. And very often we talk to these people in positions where they could potentially make decisions for countries. They would ask, so there's Slovakia, as Dr. Raman had outlined, there's Slovakia, there's vaccine, there are drugs that could potentially come online in the next few years, but tell me which one works, that one thing that I can invest in. And unfortunately, I think there is no one thing that will solve dengue. It's going to require an integration. And not only that, but the solution for one part of the world or one country may be very different from the solution for another country. So there's going to be that heterogeneity because of the, as Bill said, right, the environment is different from depending on how we have kind of modified the environment. And so the solutions may be slightly nuanced. But I think fundamentally the other, besides the fact that there needs to be an integration, my fear is that as Dr. Sen and Dr. Aldighieri pointed out, there is no good and harmonized surveillance system such that we can compare data from one country to another or from one part of the world to another, so that we learn the lessons as these tools are being implemented, and we learn the lessons that's needed to become more effective with how we implement these solutions.
So we've gone from a dearth of tools to now maybe an abundance of tools, and it's hard for countries to figure out kind of which one, which combination, and how they should roll these out. Bill, you do a lot of work in the Amazon. As you see these new tools moving through the kind of pipeline and approvals, what will be most relevant? What are the challenges for accessing it there?
You know, I was thinking of it as they were talking, and I think in the sites that I work in, you know, I work in Madre de Dios, Peru, which is on the border with Bolivia and Brazil. And then we have a site near Tabatinga, which is on the tri-border of Colombia, Peru, and Ecuador, or Brazil. And then in Pastaza, which is the border of Ecuador and Peru. And that's an indigenous region. Every one of these places has one fundamental problem, which is there's no -80 freezer. There's no regular electricity. So if you want to start, there's an Oropouche outbreak. Dr. Aldighieri probably knows about this very well. That was a delayed diagnosis because the tools are not in the field to identify those viruses as they appear. And in these areas that's high biodiversity, it's a changing environment, both the climate and the land, you're going to have new emerging diseases come out, and you need to have biosurveillance capacity in these places. But there's fundamental infrastructure weaknesses that exist that are just never addressed. And I think those are things that we need to start thinking about.
Absolutely. It's great to have so many experts on the panel who think about the many dimensions of this. I'm a money nerd, and so I think about the financing side and financing as a bottleneck. And the reality is, so many of the municipalities that have had dengue, they've had so few tools that they've required relatively small budgets to do spraying and larviciding. But these new tools are expensive. You know, vaccines are not cheap. All of the work to roll out something like Wolbachia or make therapies and testing more widely available requires resources. Aravindan, I'd love your thoughts on the financing side. What's it going to take to mobilize financing for countries to be able to roll out these new tools?
Yeah, firstly, I think the kind of social investment that we drive is peanuts compared to the kind of public financing that governments get access to, right? So the question becomes, how do we then use that capital, whether it's philanthropic capital or any kind of return-seeking concessionary capital, in a way that is catalytic? And for that, I think, again, they look to the governments to say which way they are leaning towards. And in almost all of these cases, the solutions, if we have to solve this, the solutions need to run at a faster pace than the problem. And the problem is getting out of hand already, as we see with urbanization, but also with climate change, it's getting out of hand very fast. So which means that if we are able to deploy risk-taking capital right now in making some of these bets to assess how do we get in front of the problem, that's the part that can help even governments then make better decisions when they're tapping into grants and they're tapping into, financing from, global organizations, the World Bank or ADB and all of these. But I think fundamentally it goes back to health systems, like you're saying. Health systems are already weak. And if we find a way to then approach this from a health systems point of view, the return on investment argument goes up drastically, right? Today, if you're going to look at only the dengue argument, you'll be like, okay, there's probably, cost of treating this, loss of productivity, loss of income is like about 2 months worth of a medium household income, right? But if you actually look at it as a solution that can address multiple things, then your ROI goes up drastically. And then it's also easier for the governments to then make that case and make that investment and then bring in the private sector capital. So I think some level of harmonization and alignment between the governments and what they're investing in and the kind of solutions that we deploy, and with the private sector, how it can be catalytic. I think that is the kind of thing. And we have done this before, obviously, with many other situations. So we need to find a way to see how do we do it in this particular case.
And we heard yesterday during the financing panel that there is money in the system, right? Partners like the World Bank, the IFC, the Global Fund, the Green Climate Fund, philanthropies like Reaching the Last Mile, Rockefeller Wellcome Trust, they want to be spending at the intersection of climate and health on the most urgent needs and the best solutions. But one of the challenges we face in dengue is the data just isn't that great. Dr. Raman, you've been thinking a lot about kind of the need for new resources as you plan for kind of approvals of new tools. What are the data questions that we need to solve in order to give confidence to funders and to equip countries to be able to kind of request this financing for innovative dengue solutions?
Thank you very much. I think one of the points which you raised initially was the issue of burden estimation. There is a need for periodic burden estimation. I'm not saying you need to do it every year or anything, but at a given point in an urban center or a point of outbreak, we need to estimate the true burden of the disease, because 80% of the cases are asymptomatic and we don't capture it. And there are ways, as Dr. Sen pointed out, we can have serological surveys. We need to do a proper burden estimation so that we are able to tell the decision maker that the true picture is different. And it is not the pure lab confirmed or those which gets reported in the health system. So the number of cases is huge compared, because the burden is, it's about 80% are not seen. So this is one factor. The second factor of the main issue here is there is a need for a programmatic approach to deal with this. Please don't treat dengue as an outbreak disease. Countries which have been affected with dengue since 1951, it is endemic. So today more than 100 countries are endemic for the disease, and we really need an approach where even though there may not be an outbreak, we need to shift to prevention and then being prepared for managing an outbreak, and prevention will be more cost effective in the long run. Thanks.
And we're finally in a position where we have some real prevention tools coming online. Things like vaccines, things like the mosquito technologies that we've heard about could do a lot to dampen the outbreak risk of dengue before the monsoon season, before the flood that's causing these outbreaks. You know, we're here in Baku, Azerbaijan, for this conference. We'll be back in November around COP29. And then, of course, next year, COP30 will be in Brazil. Brazil has both been one of the innovators on dengue. Fiocruz is looking at local manufacture of mosquitoes for some of these innovative technologies. They've also been one of the hardest hit countries in the world. So let's kind of look at November and then the end of next year. Where do we need to be? What problem do we need to solve in the next, can't do math live on stage, but call it 18 months in order to better equip countries to respond to this challenge? And let's just do a quick round robin and then hopefully leave time for a question or two. I would encourage those of you that have the app to add any questions that you might have for this group. I'll just keep the running order that we have, but please keep your answers brief. Dr. PK Sen, over to you.
I think the most important one that we need data. We have to collect data from different sources, what is available, and to put forward the dengue burden in a specific for any country, so that we can advocate that more funding is needed for research, for program implementation. This is one. And secondly, we must have some preliminary data from other sources, other departments or ministry, like the climate data. Climate data with coordination with other ministries, and this coordination is very important. And this will also improve the data management as well. And what is more important is we need to have some concrete base for putting advocacy at the forefront.
Yep.
Thank you.
Absolutely. So it's data, not only health data, which we've talked a lot about, but also data from other ministries, integrating with climate data. And just to remind our viewers, we had an excellent session yesterday where we heard from ministries of health and ministries of environment in Indonesia. Indonesia, another country that's been hard hit by dengue, but is really fighting back with some of these innovations. Dr. Aldighieri, the world will, of course, be looking this year to Azerbaijan and then next year to Brazil. Where do we need to be by the time we arrive at COP30 in Brazil?
I'd like to reinforce the points made by my colleagues regarding an integrated surveillance and providing decision makers and investors with better data. And integrated surveillance, different components. We have, of course, the point of care test that would help us to better characterize the status of a patient. I will again and again talk about laboratory-based surveillance using molecular tools, including genomic surveillance, but also surveillance in vectors, identified virus, arbovirus in vectors. And this linked to climate change observatories. We should do our best to link the public health, the surveillance in humans to observations with harmonized criteria of what is happening, including climate, temperature, floods, rains, etc.
Terrific. Thanks, Dr. Aldighieri. Dr. Young, over to you.
I fully agree with what's been said. I think data is critical, especially incidents, dengue incidence data. But my desire for the more standardized set of data is not so much for informing, the burden of illness and how to cause the disease and therefore the intervention. I think actually my concern is that once we start to roll out these new tools like vaccines and Wolbachia, what will happen is that the authorities will be more aware about case detection because we want to know about vaccine safety, we want to know about how well the Wolbachia works. So we'll start looking for dengue cases. What then happens is that because of the more active surveillance after the new tools are rolled out, artificially the number of cases is going to be much higher than before the tools are rolled out because of the lack of sensitivity in the pre-intervention period. And that would then would lead to an interpretation that nothing works against dengue. And that's my greatest fear, that actually I think we have good tools to use now, but the way we're going to roll it out has not been well thought out, and it could potentially backfire on us. Thank you.
It's a counterintuitive problem. We have powerful new tools. They might actually make cases go up as we get better data as we're rolling out these tools. Dr. Pan.
I would probably say that in every national action plan, we have to create a climate and health observatory network. Countries should establish networks that are built on a One Health framework so that they can think about different ecological zones in their country. They have to connect within their country so they can communicate, share science, share policy, share interventions, build trust, and also communicate across countries, especially places like the Amazon that share an ecological zone and share risk. But those networks need to be created, and it needs to be part of the national action plans.
So sharing between countries, we've also heard about kind of advocacy efforts that can unite across regions. And as we've been looking into this problem, we've realized that just doesn't exist to the same degree that it does in better funded spaces like the malaria effort, for instance. So a lot of cross-country collaboration that needs to happen. Aravindan, what are your thoughts by COP30?
This is a tough one because, we always tend to overestimate what we can achieve in 1 year and underestimate what we can achieve in 10 years, right? But if it was that one thing, I would say at this point exactly on collaboration. We need mechanism. Because this research and data, I think there is a lot of things that are coming out, but it's taking too long to hit the real world, right? It stays within that closed circle. So if we have mechanisms that can take this data, aggregate it from different places, and also translate it real time so that then we can bring the rest of the world along, then I think we have a fair chance of actually making it a priority.
Yep. Dr. Raman, finally to you with this question. Where do we need to be by COP30, or if you want to do as Aravindan said, maybe by 2030, where do we need to be to see dramatic change?
Thank you. I think in COP28, we had a day on health, to be honest, for the first time. We really hope by COP30, we will have more than a day on health, and that dengue and vector-borne disease would be given a priority here, or at least a space to be considered as a big threat to the world population. And this is something we really need to advocate, because right now we are still weak in going, as Aravindan had said in the beginning, there are a lot of competing priorities with climate change. We need a resilience plan, we need integration, and we really need to see that this is on the agenda of COP30.
That's a great point, Dr. Raman. We didn't tee you up to say that, but we might have thought to. We have, of course, heard from Vice Minister Rafiev the first day of this summit about how health is playing into the agenda for the COP29 planning. And I think your point is a great one. It's not just about kind of replicating what we did last year and having health on the agenda. It's about showing actual traction toward addressing these challenges from an innovation standpoint and from a policy and financing standpoint. And I know that we'll be hearing from our colleagues from Azerbaijan momentarily. Let me close with a question from the audience. This is from a colleague at Fiocruz in Brazil. They ask, we're seeing increases in the coming decade due to demographic and climate conditions. How, new tools will be an important part of this, but how do we reduce the burden of disease and especially deaths? What are your views on treatments and medication development that are needed for investment? So, Dr. Aldighieri, this is something you emphasized in our pre-panel conversation, that we really need to focus, even as cases rise on reducing deaths. What do we need to accomplish that?
Oh, yesterday. We needed to do it yesterday and previous years. Managing shock should be done at primary healthcare level. We can save life with the use of very structured clinical management protocols. And this is where we can save life. This is early detection, this is prevention of a shock, this is detection of severe signs. This is the first thing we have to think about. And of course, planning already now for antivirals, planning for the introduction of a vaccine in the general population, and more countries having access to the different vaccines, existing vaccines, and vaccines that would be produced in the coming years.
Thank you, Dr. Aldighieri. Aravindan characterized this clock that we're staring at as a doomsday clock. The doomsday clock is rapidly approaching zero. So let me just reference, we had another question, but Gavi has added dengue to its vaccine portfolio, which is potentially one new source for financing as we look ahead. Let me just say that this has been a fantastic conversation. Obviously, there's a lot more we could talk about. Next year, we can do the director's cut, the 2-hour version of this conversation. But it really doesn't end here. The learnings, the conversation that we've had on and offline today will be part of what we recommend to the COP29 steering committee. It's also informing some work that we're doing with partners around key advocacy messages, communications messages that we've been developing with a group of partners who are deeply interested in growing the advocacy ecosystem and financing for dengue control. So really appreciate all of your time, your commitment to this issue, longstanding, and your comments today. Please join me in thanking our panelists. Thanks very much.
Very nice.
Thank you very much, Martin, and panelists, for that interesting panel discussion on climate-sensitive disease. Let's play the final installation of Climate and Us.
Eu comecei a sentir uma dor de cabeça. E aí eu comecei a sentir uma dor no corpo muito forte, febre também. Só que eu achava que eu estava gripada, era uma gripe, um resfriado. As pessoas não ligavam os sintomas à dengue diretamente. Não tem assim um medicamento específico para isso. Aqui tem valão a céu aberto, tem esgoto. A gente não tem estrutura para lidar com tantos pacientes. Se a gente tivesse assim um surto de dengue aqui na comunidade, seria terrível. A gente faz esse papel, né, de preparar e educar as pessoas para o que pode vir. O agente de saúde está lá para ouvir, para escutar, para aprender e para ensinar também, né?
Bom dia!
Alô,
passa lá para ver o exame.
Legal, valeu.
Patinha, chegamos.
A novidade, ela gera espanto, né, nas pessoas. Quando a gente ouviu falar do Wolbachia, a gente achou assim, meio esquisito, né? A ideia de um mosquito que combate outro mosquito, né?
Wolbachia is a very common bacterium in nature. We infected the mosquitoes with the bacterium. The mosquito is not able to transmit to the next times that they bite someone. So it blocks the replication of viruses like dengue, Zika and chikungunya. We infected the Aedes aegypti eggs by introducing a tiny needle into their eggs.
If a male mosquito has Wolbachia and mates with a female that doesn't, then the eggs she lays won't hatch. If the female has Wolbachia and the male doesn't, she will lay her normal number of eggs. They would all hatch and all offspring will have Wolbachia. Over a few generations, the number of mosquitoes carrying Wolbachia increases rapidly until nearly all the mosquitoes within this population have the bacteria.
We finally get a mosquito line having Wolbachia and then therefore being able to block dengue inside this particular mosquito. In a particular area, we release mosquitoes once a week for around 4 to 5 months, and Wolbachia mosquitoes will be able to cross with that particular mosquitoes that live there, and then we have a sustainability of this process.
E as pessoas ficaram receosas. Imagina, você vê um monte de gente soltando um monte de mosquito, é meio estranho. Mas a gente foi explicando como é que funcionava, que era um mosquito que era usado para combater outras doenças, né? A gente ia soltar, e depois ele ia sumir, ia trazer o bem para a população e as pessoas foram aceitando.
E reproduz um mosquito que não tem como transmitir a doença. Isso aí, acabar com a dengue.
We've been working in Niterói since 2015, doing some releases in very small areas, but now we are almost ready to go and finalize the whole city, which is more than 400,000 people being protected after Wolbachia establishment.
When we do the analysis, we are seeing a 69% reduction in dengue cases around the city.
In Rio, it's a very complex situation because we have lots of favelas there. You have invasion of wild-type mosquitoes, therefore you get a dilution of this effect of Wolbachia compared to other areas. It's very important in all our strategies. We say Wolbachia is complementary approach, is not the silver bullet.
The Wolbachia method is something in addition to what we should be doing to minimize the breeding habitats, to minimize the proliferation of mosquitoes in those communities. And if you look at Europe, we see a sort of an expansion of the Aedes mosquito in areas where you didn't used to see it before. This has to do with the warming and temperatures and weather climate. And if you take last year, 2022, we had about 71 cases of dengue in Europe, locally transmitted. And that's equivalent to the total number of dengue cases that were observed in Europe from 2010 to 2021. So that gives you the magnitude of outbreaks we can have in areas that we didn't used to have arboviruses because of climate.
Eu acho muito interessante como tem evoluído, né, a questão assim da biomedicina, da ciência. É muito gratificante, né, lidar com pessoas, principalmente assim, com pessoas que eu conheço, que me viram crescer, poder ajudar um pouco essas pessoas e que daqui pra frente, né, descubram curas e que a gente tenha uma população mais saudável.